Hello, my name is Dr. Robert Orr. I'd like to take a few minutes to introduce you to, or perhaps reintroduce you to, the BIOTRONIK DX ICD system. Since its commercial US launch in 2013, there have been over 10,000 implants in the United States and over 20,000 worldwide. I must admit, I have contributed my fair share to this number because I have found the system to be not only easy to implant, but also offers me dual chamber diagnostic capabilities. The BIOTRONIK DX system is the only single lead ICD system with dual chamber diagnostics. What makes the atrial sensing component unique is that the incoming signal is amplified by a factor of 4, and then specific filtering and default settings are applied to allow for a 96.5% rate of accurate atrial signal detection at all times. What is equally important is the P wave is stable over time. In my experience of nearly 3 years implanting this system, I've not seen any significant change in P wave amplitudes. The BIOTRONIK DX system is the only single lead ICD system with atrial fibrillation diagnostics. In this patient population, many of whom have high CHADS-VAS scores, the detection of atrial fib, that may be subclinical, has a significant impact on stroke prevention. The BIOTRONIK DX system captures the benefits of both single and dual chamber ICD systems. As a single lead system, it reduces lead complications, procedural complexity, and eliminates the cost of an atrial lead. As you are probably aware, there is a general trend towards less DFT testing at time of implant. With this in mind, the BIOTRONIK Inventor DX offers 42 joules of energy delivered from the very first shock. Not only does the BIOTRONIK Inventor DX offer the highest first shock energy of any device in the market, it also offers programmable, automatic, alternating polarity shocks in patients in which either DFT is not tested or a further increase in DFT could happen. This could offer you yet another level of comfort, knowing the device is automatically giving you the best chance of converting your patient. And of course, it is approved as full body MRI conditional. The lead. This is the DX lead. It comes in 2 lengths based on patient's anatomy and requirements. The 2 lengths vary from the tip of the lead to the atrial dipole. This is the atrial dipole. This is where we ideally want to get this in the middle 1/3 of the right atrium. And this will attach into the right ventricular apex or into the septum. This will be the other end. Lead going in. Pan down, please. Pan down towards the feet. Yep, perfect. Thank you. Stop. We'll try to find a home for him to go. We have these. And out to the apex. And you see the atrial dipole there, probably in the middle portion of the septum, of the atrium. Wrench. And we deploy the helix. Now, as I move the stylet back, you can get a little better placement of the atrial dipole. See it flops down a little bit there. And a little bit of a heel on the lead itself. Now we'll test our ventricular signal. Red ring. Black tip to you.
590, stable. Coming down from 5. There's 3 volts, 2 volts, and 5.
Now we'll check the atrial signal. And keep in mind we want at least a 0.5 millivolt atrial signal. But again, keep in mind this is going to be magnified 4-fold by the circuitry in the DX can. Red ring, black tip to you. So that's excellent. So we're going to see probably a 6 or 7 millivolt P wave once we hook up to the can. That's basically it, guys. Now we're just going to secure the lead in place. So basically we installed a dual chamber system with a single wire. I don't have to worry about getting called later on to come back in and for a dislodged atrial lead. but yet we have the diagnostic capabilities of a dual chamber system. Done. Implantation of the BIOTRONIK DX system is not much different than implanting a single chamber pacemaker. Access is made, for the most part, using either the subclavian or cephalic veins. The pocket size is basically the same as other ICD systems. The lead is usually placed either in the right ventricular apex or on the septum. The goal is to have the atrial dipole in the middle 1/3 of the atrium. The tip to atrial dipole distance comes in two lengths to accommodate different cardiac anatomy. One likes to achieve a reasonable P wave of at least 0.5 millivolts, keeping in mind that this will be amplified fourfold by the DX circuitry. The lead is actively fixated in the right ventricle and secured in place. It is then connected to the DX can, which is placed in the pocket. This case went very quickly, and we don't have to worry about potential atrial lead dislodgements and having to go back to reposition the lead the following morning. I mentioned the importance of rhythm discrimination. With single lead ICD systems, there is always the question of whether that high rate event was supraventricular or ventricular. Many times it is impossible to tell by a single lead EGM. Let's take a little test. Can you tell if this is VT or SVT? How'd you do? Let's try another one. The BIOTRONIK DX system offers rhythm discrimination with its unique enhanced atrial signal capability. This allows not only improved diagnostic qualities for differentiating atrial versus ventricular disrhythmias, but also provides therapeutic benefits in diagnosing and treating previously unknown atrial fibrillation. It does this by decreasing complications, decreasing time and cost when compared to a dual lead system. The Aventra is the highest energy output available and alternating reverse polarity for patients with potential high defibrillation thresholds. And remember, the entire DX family is approved as MRI conditional. I hope this gave you some insight into what I have found to be a very valuable tool in the treatment of my patients. I hope you give the BIOTRONIK DX system a try in your practice. Thank you.